Bone marrow biopsy procedure demonstration.
Hey, so today we're going to talk about doing a bone marrow biopsy. A couple of things that you need to know. One is that this is the bone marrow biopsy kit. So if you would show them the kit, we're going to do it like this and they can see. It would be something like that. And what is usually included in a bone marrow biopsy kit is the aspiration needle, which is a smaller one, and then you have the core biopsy needle. You will also have to make a little hole here, we use the surgical knife over there, and then you would have also a little bit of the lidocaine, but you always keep in mind to have an extra lidocaine in case you needed it for further use into this. Then we also have, can you turn this around? This is one of the kits, the bone marrow kits. But you need to know that in each bone marrow kit, there is two of these. Hold up one of them. And one of them is for core and the other one is for clot. And then we also have four tubes, two of the green top tubes and two of the purple top tubes. There's another four of another purple top. So what you do is that you usually do two of the purple one and two of the green one should be okay. And that's for the flow cytometry and the cytogenetics analysis that they do. And also we would need two of these syringes. Can you give me the other one too? The two 10cc syringes extra for aspiration that we need to do. The very first thing is that you want to mark where is the bone marrow biopsy going to happen. It is on the superior posterior iliac crest. So you hold your finger up onto the anterior superior iliac crest and do like this, and by one hand you go down and there is a notch here. Okay, you feel the notch here and then you feel the bone. That's the most superficial part of the bone, posterior superior iliac crest. And we do a check mark with like either a pen or a marker, whatever you do, just put a marker over there. Then the next step is, of course, to clean the area with betadine. And so we're going to use some betadine. So you're going to feel a little bit cold on the skin, and that's for just the cleaning. And you start from the center and then you go around, okay? And again, you're going to start from the center and you just go around. You do not come back to the center, just like any other surgery or procedure you do to keep the area clean and good. And then we're going to cover this area with a cover sheet that comes from this tray. Then we're going to numb this area. For the numbing, you usually use a smaller needle. I'm going to be giving you the numbing medicine. It's going to feel like a little bee bite. If it bothers you, deep breath in and out. And when you do the under the skin, you can just see the induration over here that you can come look closer and you just see that it goes a little bit higher up and you can see it. Then you go closer to the bone. And if the bone is further down, then you can also go ahead with a larger size needle and go further and then do the injection of the lidocaine a little bit closer to the bone. He is a smaller size, so I don't need to go very deep down to give the numbing medicine. Then we're going to use the aspiration needle to do the aspiration. Always you want to check your equipment, make sure they're working well. And then I think you can come around or this way around that you can see this better. And here I'm going to go to the area that I numbed it up. And you're going to feel some pressure but not pain. And I'm going to go through the bone. And at this point we're going to aspirate. You're going to feel a little bit of a pulling sensation, but no pain. If you do, let me know. A deep breath if it does bother you. Deep breath in and out. We're doing well. We're getting the aspiration. And here I'm going to transfer this to the other tubes. And then we're going to aspirate a little bit more. That was our purple top tube. So she, yeah, you want to show her? How do you follow her to it? Let's see how she opens up the lid from them. And she puts your fingers on top of them. And then you just shake it that way. That doesn't spill out. Okay, so bring your green top tube for me. And then we're going to transfer these to the green top tube too. At the end, I'm just going to also get a little bit left for my clot. Come over here. I'm going to get a little bit left into this one for my clot. Put it over here. I'm going to put this needle back in here. Okay, and I'm going to take the aspiration needle out. And we're halfway there. Okay, I'm just putting some pressure over here. Okay, so now I'm going to do the second part, which is the biopsy part. I'm going to make a little tiny cut at here because our needle is larger for the core biopsy. So this is the core biopsy. And this is your again, uncap this one. You want to always check your equipment with this side of it. We're going to be going here. Okay, again, you're going to feel a little bit pressure, but no pain. If you feel pain, you're going to let me know. Take that off. And then we're going to use the core biopsy needle for the biopsy part. Deep breath in and out. If it starts bothering you, let me know. Are you doing okay?
Yes, ma'am.
Okay. Okay, I think we are good. You want to a little bit pull from here, that sometimes the cord gets stuck in there and doesn't come out. And you screw a couple of times to the left, couple of times to the right. And there's another one. No, I'm good. I have this one. It should be good. The little cap thing here it is. It just depends on type of the other one doesn't need that because it goes right into it, but this one you need to put this in there. Okay. And then I'm gonna go to this. Okay. Now stop pulling from here, and now we are going to check to see if we got a good sample. And for that, there is another one that there's an instrument like this one that you go through the core, and then you want to see if you got a good specimen. And you can see this one. Oh, here it is. You see the core in the middle of here? The clot is attaching to it, but this is the core. That core part of it, see? Okay, yeah. Good, so we can use that one for the core. We're good. We got a good specimen, and we're gonna just clean up here. And as you can see, this is not like a bleeding kind of thing. Usually it doesn't bleed, and right away what you do is that you just clean surrounding this area, and we put a band-aid here and put some direct pressure over here that it would not bleed. So as you know, I'm going to put a band-aid here and put some direct pressure over here, and This direct pressure will stop it from swelling or pain or bleeding. And after a few minutes of direct pressure, we're going to turn you over and have you lay on your back for about 5 to 10 minutes. If everything is okay, then we'll let you walk out of here. So a little discomfort for 2-3 days is normal. You can take some Tylenol for that. But if excess pain, bleeding, or fever, you're going to call us. Go ahead, put your finger over here. Now, when you collect the core, you want the core is going to go to one of these containers, the formalin one. So we already have this core of the biopsy. We're going to put it in here. When the clot forms, which has not yet, we're going to transfer the clot to the other formalin container. I'll let it here clot. And then on this ones, we're going to create the slides. And for that, you just do 1 drop of the purple top tube on one of your slides. And we're going to make a smear. To make the smear, we take a small amount of the blood here, put it flat here, and slide it down. And again, if you have too much blood, dry it out and then flatten it, slide it down. Okay? The less blood is better. It will be a nicer, thinner slide. And again, you do that. And you make a couple of these slides. You let them dry. And when you dry them out, okay, then we put them in the container. All of these slides has to be labeled by the patient first name, last name, date of birth. So we already handwritten them before we make any of these slides. The same thing, all the containers and tubes have to be named and labeled to be able to be transferred. Okay? And these are the tubes. They're all going to be labeled and along with the clot and the core. And then, of course, you know how to dispose your sharps. Very good.